Hello, I'm Anne-Marie Hoey. I'm National Director of HR. Over the next few minutes, I'm going to take you through a presentation of the changes associated with the Corporate Centre Review. This presentation sets out the background to the Centre Review, the key changes being made and the benefits, the transition structure being implemented from next Monday, 14th of June 2021, and finally, the long-term structure. By way of background, the CEO commissioned a review of the Corporate Centre of the HSE in January 2020. He wanted to design and put in place more effective structures so that the Centre can support our services better. But as we know, a lot has happened since January 2020. As the review got underway, the pandemic and our response to it showed us that the HSE Corporate Centre could work with our services in a more effective way. The pandemic helped to drive change very quickly, and so this rebalancing of the HSE Corporate Centre is a result of the review, but it is also influenced by lessons we have learned in managing the crisis we have faced since early last year. We believe the changes will improve decision-making, speed up our responses to service requirements, increase collaboration, and improve engagement with stakeholders, building up trust and confidence in the process. The key principles used in conducting the review are also outlined here and include taking a pragmatic approach and focusing on improvements in the way we work. In terms of meetings, workshops and consultations, we consulted very widely on this. Many senior managers and individuals from around the organisation took part. We ran design workshops and we consulted with international experts in relation to design. So what are the key changes? This slide sets out the key changes being put in place from Monday, 14th of June, and I'll mention a few of them. As you can see, integrated operations will be strengthened with the addition of service planning. We are setting up a patient and service user experience unit, and national schemes and reimbursement will become one national entity. The clinical function will now include a single national quality and patient safety function, a clinical programme delivery function, and integrated clinical care design and innovation is being redesigned. My own area of national HR will take on recruitment, pensions, and national personnel records. A HR culture and capability function will include the job of engaging with staff. The National Integrated Staff Records and Pay Programme, NISRIP, will also join National HR. HBS functions are moving to related corporate functions. For example, in addition to those mentioned for National HR, HBS Finance Services, Payroll and Procurement are moving to the HSE's Finance Division. And it's important to say we are committed to continuing to further build shared services. The Healthcare Strategy Division now includes governance and risk, change and innovation, digital transformation and innovation, a redesigned strategy and research unit, and capital and assets. Two further changes to mention are Healthcare Audit, which has moved to Internal Audit, and SAP COE Centre of Excellence, moving to eHealth and Disruptive Technology. Important lessons learned from the pandemic period have been taken on board to inform the design. Here we focus on what we hope the review will achieve. The outcomes will result in faster transformation of our health service, more integrated healthcare delivery, and the development of new ways to give services to patients. In terms of benefits, we believe that the changes will put our main activities in the best place within our central structures. This will allow them to give better support to our hospitals, community services and national services. They will also drive better performance and accountability. People who deal with us will have greater clarity as to how things work. For example, bringing national schemes and reimbursement services together under one function will make it much easier for people to engage with those services. This slide contains details of the team changes being implemented from Monday next. As outlined earlier, a number of teams are moving into different functions. Over time, a population health and prevention function will be established to include test and trace, public health, environmental health, and health and well-being. We will also be moving to a more integrated structure for acute and community services. So what do these changes mean for individuals and teams? The HSE Executive Management Team members and National Directors have recently been outlining the plans to their teams and will provide additional updates. Communication is ongoing and the current phase will be completed as soon as practicable. I want to take you through the purpose of a number of divisions. First, the Healthcare Strategy Division sets the strategic direction and drives transformation across the HSE. This function will work with the CEO and the Executive Management Team to define the strategic direction for the organisation. It will gather and interpret global research and trends and will lead the delivery of major transformation programmes, including Sláintecare. Integrated Operations provides leadership and oversight of all service delivery across the HSE. This function is responsible for service planning activities, service contracting and partnerships, setting service standards, as well as monitoring performance and reporting against standards. The Clinical Division is accountable for integrating clinical leadership across the healthcare system, from service and policy design to planning and implementation, placing clinicians at the heart of decision-making, creating a healthcare system informed and shaped by care pathways which meet patient expectations. This slide illustrates the long-term target structure for the organisation. You can see the population health and prevention function plan for the future is represented here. Also, the more integrated structure for acute and community services is also represented here under Integrated Operations. This slide represents the structure from Monday, 14th of June. It details all of the changes we have mentioned, but doesn't include the future changes shown in the long-term target structure in the previous slide. So thank you for taking the time to hear about these changes. This video will be available on our staff website, and you'll also have the opportunity to submit any questions you may have to our internal communications department. Thank you for watching.